information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Hi, I'm Marie Beach, your host today. I'm the Healthy Schools Coordinator for the Department of Health, and I've been working for the Department of Health for 20 years and work closely with the Department of Education, other government departments, and most community health partners that have programs and activities in schools. Our topic today is osteoporosis, and our guest today is Dr. Annabel Fountain. She's the founder of Fountain Health. Good morning, Annabel.
Good morning. Thanks for having me.
And thanks so much for joining us. Please tell our listening audience a bit about yourself and your role at Fountain Health.
Okay, well, I am Bermudian, and I went away to boarding school when I was 11 years old, and then I went to medical school in London, and then I worked for 10 years in the NHS, doing my like the equivalent of intern and resident and then fellowship. And so I finished my specialty training there on the 31st of July 2010. And on the 2nd of August, I had a one-way ticket west home. And I started work for the hospital in September 2010 as the director of endocrinology. So I'm an endocrinologist, and that's the study of hormones, and it covers anything from diabetes to thyroid problems, whether it's overactive or underactive glands or tumors of glands, but any gland that makes a hormone means that it's in my specialty area. And I love it. So Fountain Health, I started that in 2017. So I was the director of endocrinology at the hospital for 7 years, and then I started Fountain Health. And it's an amazing thing. It's very different, being sort of autonomous and self-employed compared to working for an institution. But it has its own freedoms, and I absolutely love what I do. It's a fascinating specialty. Every day is different. Every person is different. And it's wonderful to be able to help.
Thanks for that wonderful introduction, Annabel. So our listening audience would love to learn more about osteoporosis. So what is osteoporosis and what are its symptoms?
Okay, well, the first thing about osteoporosis and symptoms is they really aren't any until you break a bone, right? So osteoporosis, osteo is bone, porous means it's got holes in it, right? So just like if you had a sieve with tiny holes, right, that's a much sort of stronger structure than if something's got bigger holes, right? So it's when your bones are fragile, they're more likely to break. So it's a fragility disease, and it's something that affects older people. So as we're growing through our sort of childhood, through puberty and into our 20s, we are building bone, and we reach our peak bone density in our 20s. It's all downhill from there. We can all relate to that. All downhill from there. So we're losing bone from there on. And if we didn't build good bone as children, we didn't have good nutrition, or we were ill for some reason, then we might not reach our potential for bone density. And so later on in life, if we've got low bone density, then we're at increased risk for fractures. So that's what osteoporosis means, is it's thin bones that are more likely to break.
Okay, thanks for that. I'm just wondering how osteoporosis affects bone density.
Okay, so bone density is, if we think about it, is really what a bone looks like on an X-ray. So the test for bone density is an X-ray. It's a DEXA scan. There's multiple different places in Bermuda that you can get that done. And, when you look at an X-ray, the black of the film, well, it's not film anymore, showing my age, the black is the air or anything that doesn't have calcium in it, and anything that is white is calcified or it's bone. So when you look at an X-ray, if the bones are kind of gray rather than sort of bright white, they're probably thinning. So the density of the bone is one thing. The strength of the bone is something else. Now, you can't really test the strength of the bone until you're trying to break it, right? So, if you fall off a horse when you're 25, it's not surprising if you break something. That doesn't mean that your bone is fragile, right? But if you trip over when you're 70 and you reach out to stop yourself falling and your wrist snaps, that's fragility, right? So bone density is interpreted from an X-ray. It's not a test, it's not a quality test, it's a quantity test. So it's looking at how dense the bones look, but it doesn't actually tell you how strong the bones are, because we can't really test that. Certainly, a bone that doesn't look dense is usually fragile, right? But that's the test that we do. So it's the only one that we really can do.
Wow. Yeah, I was just going to ask you what the difference would be when you think about bone density versus bone strength. And it makes sense. You can't tell.
You can't tell,
how
right?
Strong
exactly,
a bone is.
Until you try to break it. So, if you fall over in your 60s and you bounce, great. You're doing really well. But older people have an increased risk of fractures because our bone density is going down as we get older. But also, if you can't see as well, you might trip over something. If you are weak, you might not pick your feet up properly and you might trip over something, or you might have problems with your balance and fall. So there's lots of other reasons why older people fall. And so breaking things has got multiple risk factors. And so if we see somebody with osteoporosis, we should also be thinking about, does it matter, right? Of course it matters, but is it something that we need to be really, really careful of with this person? Should we be sending them to physiotherapy to improve their muscle strength? And so that they are less likely to fall and break something.
Wow. So could a family member just look at their loved one and see that they have osteoporosis?
No, you can't. A little old lady who's got a stooped back, right, probably has osteoporosis in their spine. As people get older, they might lose height. So this little shrinking person, that person probably has osteoporosis. So yes, there are signs, but that's when it's very, very severe. If someone just has low bone density, you can't tell.
Wow. So if you were to look at someone's hands and their knuckles look a little disfigured, would that be osteoporosis?
No, that's osteoarthritis. So arthritis is inflammation of joints, and it can be caused by multiple different things. Arthritis, inflammation-itis, is usually painful. And so those kind of joints can be stiff or achy, or they can lose strength. You've got to ask somebody else to open a jar for you. But that's not osteoporosis, that's osteoarthritis.
Okay, I just wanted our listening audience to kind of be aware of some differences.
Absolutely.
But definitely keeping their eyes on their loved one who may be becoming more and more fragile as they age.
Absolutely, yes.
So you talked about nutrition as being related to osteoporosis. Can you expand a bit more on that?
Absolutely. So our bones are made of calcium and phosphate and other important minerals. And if you as a child are, don't have foods that are rich in calcium, phosphate, so milk, or dairy products, etc., then you may not have as much bone density as somebody who lived on a dairy farm and drank milk every day. And really, really interestingly, 68% I think of people of African descent in America are lactose or dairy allergic, right? So so that's really, really common, and so a lot of Black people haven't had enough calcium in their diet. Now, there's lots of other sources of calcium. Just because you can't drink cow's milk doesn't mean you can't have goat or sheep's milk, because there's different proteins they're not allergic to. But there's vegetables like broccoli is very high in calcium. A lot of the time, hard cheeses are tolerated. So soy has calcium in it, and a lot of the nut milks and processed foods, which I'm not a fan of, but they are often fortified with calcium. The other thing that's really, really important for your bones is vitamin D. And vitamin D is the sunshine vitamin. We make vitamin D from cholesterol, actually, in our skin, in the presence of ultraviolet light. And if you're very, very white like me, you will probably make quite a lot of vitamin D if you sit in the sun. And you can't sit in the sun too long because then you burn. But if you've got natural sunscreen, you've got darker skin tone, you will not make as much vitamin D, and so there can be vitamin D deficiency in people with darker skin. And of course, people with light skin tones who wear sunscreen can also have vitamin D deficiency, which is amazing how many people have vitamin D deficiency in Bermuda, in this sunny place. I sit in the sun trying to go brown. Lots of people are not trying to go brown because they're already brown. They're sitting in the shade. They're not trying to get that sun on them. So I quite often have people come to me who have undetectable vitamin D levels, right? This doesn't mean they don't have any, but it's very, very low levels. So vitamin D is extremely important, not just for your bones, but for your immune system, including fighting cancer. So it's very, very important that we get our vitamin D checked, and if it's low, to take a supplement. And it's actually probably worthwhile everybody taking a supplement, even if they don't know their levels, because you're probably deficient, and it's almost impossible to have too much. So, just a regular old vitamin D, 1,000 or 2,000 units a day isn't going to harm anybody. So those are really, really important. And then some people have other problems with their gut, like celiac disease. Celiac disease is where you have an allergy to wheat and your gut kind of shrivels up. It doesn't have all of the surface area to absorb all the nutrients from your food. So you may not just be calcium and vitamin D deficient, but you could have iron deficiency and lots of other deficiencies as well. So people who have celiac disease or other problems with absorption can actually be more likely to have osteoporosis. So yeah, nutrition is very, very important.
Thanks for that. I remember some years ago, I had to take prednisone, and also because I'm of a slightly lighter frame, my doctor told me I was more at risk for osteoporosis. Is that true?
So steroids and some other drugs do increase your risk for osteoporosis. I'm not sure of the mechanism related to steroids actually, but if you have steroids for asthma, if you have an asthma inhaler that you're using every day, that can have an impact on your bones. Now, obviously, the steroid inhaler is a very, very low dose, but the if you're frequently having doses of steroids for other things, multiple sclerosis or Crohn's disease or other things, then if you're having to have steroids frequently, that absolutely could have an impact on your bone density in the longer term. So something that is really, really interesting is that Black people generally have better bones than white people. Okay, Black people tend to have higher muscle mass, And so that with that, they have stronger bones. The risk of fracture in a black person is about 1/3 compared to, a person of the same age, height, weight, sex, of a white person. So the risk of fracture in black people is much lower. That's, we could talk all day about these things. It's so fascinating the way that we do these tests. So remember, we talked about the bone density scan, and it really doesn't say anything except for what it looks like on the x-ray. And if you are comparing people to themselves at 25 years old, right? If they're 50, their bone density is going to be lower. And it's all statistics. But if you compare black people to white people, their bones look a lot better, right? And that's correct. They're a much lower risk of fracture. But if you compare black people to black people, right, and there's vitamin D deficiency, or in Bermuda, most people are mixed, right? We don't really know whose genes you've got in your bones. Actually comparing someone who's black to the average black person is really quite difficult to interpret. So I quite frequently have those scans re-evaluated compared to white women to really know what the risk of fracture is, because we don't want to tell someone you need to be on medication for osteoporosis when actually you've got 1/3 of the risk of a white person to fracture. So let's actually compare you and make an evaluation based on how likely it is that you're going to have a fracture.
I'm really listening, as always, but, I'm very visual. And I'm thinking of times when I did go for my bone density assessment, and they compared last year's scan with this year's to see if there were any changes. Is that normal?
Yes, that's right. So we don't normally do the scan every year unless you've got a specific problem or we're evaluating whether a treatment's working. We normally do them every 2 years, especially sort of initially. And I always try and get somebody to have a bone density scan when they're probably around sort of perimenopause, so before their hormone levels are very low, or in men if they've got, this is other reasons why people could have osteoporosis. So most of the people who have osteoporosis are female, but men can get osteoporosis if they've had testosterone deficiency. So just like women get osteoporosis after menopause, men need their hormones too. And so men who are on steroids, men who have had illnesses or other medications that can cause low bone density, I will check their bone density. And then, if it's completely normal, I'm still going to do it in 2 years because I want to make sure it's stable. And after that, I can leave it longer. But if I'm treating somebody for low bone density and I'm helping them to improve things, maybe without medications, maybe it's supplements, exercise, healthy nutrition, we're going to check you again in a couple of years to make sure that what we're doing is working. So yeah, it's important to watch the trends. The other thing on the bone density scan, anybody who's had one, it's your report for each area. So they usually do your wrist, your lumbar spine, and your hip. The report for each area has a box, and it's got a green space and a red space, and then in between is a yellow space. So it's just like your traffic lights. Green is good, red is bad, right? Stop. So red is low bone density, and yellow is osteopenia, which is kind of on its way down, but not very low bone density. So, and then there's some lines going across it, which are showing the trends of the average person of your age, sex, and ethnicity. And so if we see your bone density going down, but it's tracking a line, we would just say, well, it's going down as expected for aging, right? But if it's going down faster than that, then that's something I want to intervene with, right? So because we know that our bone density goes down as we get older, it's not necessarily it's not an emergency, it's not something scary if it's just going down as expected for aging.
Wow, this is so interesting. So, before we get into talking more specifically about treatment, what about screening? Should everyone get screened for osteoporosis? And if so, how often or who should get screened?
So, like I said, anybody who is going through perimenopause, so women are at increased risk for osteoporosis. So, we want to know what your bone density was before your hormones went. Sure, it would be great if we did your bone density at age 25 when you're reaching your peak bone density, because then we'd have another 25 years of potential intervention to improve your future health. But that isn't standard of care at this time. So if we do it when you're kind of about to go into menopause, that's when I really want to know, because I know that it's going to go down faster now. So I do want to check things. Anybody who has a high calcium in their blood, calcium is supposed to be in your bones. If it's in your blood, why is it in your blood? Let's check your bones. People who've had long-term steroids, people who've had kidney transplants. There's a lot of people in Bermuda who've got kidney disease or other autoimmune diseases that are on steroids. And so they would need to have their bone density checked and monitored. And if your bone density was totally fine when you were 50, I still want to do it, when you're 52 to see where you're going. If it's stable, great. Maybe we do it in 3 years, then we do it in 4 years, etc. But that's the screening for osteoporosis and anybody who's high risk. Some people will have their bone density scan done younger because of a family history. So if your mum was diagnosed with osteoporosis when she's 52, goodness me, I wonder what's going on. Maybe we want to check somebody much younger than that, just to be sure that, we have an opportunity to improve things before menopause.
So I'm thinking about treatments. What treatments are available and what are their side effects?
Okay, so there are lots of different treatments. So improved nutrition, right? So if we find that your bone density is low and your vitamin D level's low, I'm going to say let's take some vitamin D. If your calcium is high and you have a problem with some glands called the parathyroid glands, then we look at them. You might have a tumor that's making too much of the hormone, and that's causing the problem with the bones. Take the tumor out, fixes the problem. Don't need medications, right? Weight-bearing exercise, so walking, running, skipping, not swimming, not cycling, right? Weight-bearing exercise is important for your bones. Your hips are the bones that or your hips and your legs are what's going to benefit the most from weight-bearing exercise. Your back is only carrying the top half of you. And so walking with a little backpack that's got 2 books in it is increasing the weight through your spine in order to help to increase the bone density in your spine. So all these are treatments, right? A treatment doesn't necessarily mean that it has to be a medication. There are medications that we've been using for 25, 30 years called the bisphosphonates. They are very safe. They're very widely prescribed. Side effects are I wouldn't say rare, but severe side effects are very rare. But side effects are quite often related to sort of indigestion. They can sort of upset the lining of the stomach. So when you're on those medications, you take them on an empty stomach, you drink a full sort of 8-ounce glass of water, you don't go back to bed, you stay sitting upright for at least half an hour, you don't take any other medications with it. Sitting up for at least half an hour lets everything sort of go down into your gut so that it doesn't cause any indigestion symptoms. Now, some people can't take those, They're available daily, weekly, monthly, and annually. And so if you needed to take one as an annual dose, it would be an injection. Interestingly, those drugs are now being used as adjuvant therapy in breast cancer. I don't know how this works, but people who were being treated with the infusion once a year were having better outcomes from their breast cancer therapy. And so that's now part of the protocol for breast cancer treatment. So, side effects are not always negative. It's really, really interesting. So those are the bisphosphonates. Then there's medications that work on antibodies. So these are they're not brand new, but they're this century, these drugs. We're talking about a drug called denosumab. When it's got a mab on the end of it, it's a monoclonal antibody. And it specifically targets one of the areas of the bone that builds bone. And so that is incredibly well tolerated. It's an injection every 6 months, and I have quite a few people on that, and it's really, really well tolerated. And then we actually have medications that are made of parathyroid hormones. So we talked about parathyroid glands. They make parathyroid hormone that helps to balance where in the body your calcium is. And if you give high doses of parathyroid hormone, it actually blocks the calcium into the bones and can build bone as opposed to weakening bones. So really, really fascinating. If you take this for 2 years, it can show a 20% increase in bone density over 2 years. That's really, really meaningful for somebody. And you don't lose that bone density. It's built. And you only take this drug for 2 years, and it is usually very well tolerated. I have a few people who had more palpitations, but they had palpitations before, but they were noticing them more on the medication. But most people tolerate it really, really well. The negative side of that is that it's an injection every day for 2 years. Now, if you have osteoporosis and you're at risk of losing height, which can, it might be that you're vain and you don't like to look like a little old lady who's kind of getting stooped. You don't want that for your future. But more importantly than that, if you're having fractures in your spine that's causing you to shrink, that's actually painful. So osteoporosis, once you're in that sort of severe stage, can be quite painful. And something like the daily injection of PTH can make a huge difference to someone's future, especially when they've got osteoporosis in their spine, which is so debilitating. It's not like, oh, I broke my hip, I can have a hip replacement. It's very, very different when it's all the little vertebrae in your spine that are crumbling. So that is a really, really excellent treatment. What else? I'm trying to think. There are newer drugs that are around. Anything that's an injection tends to be very, very expensive. It's usually guidelines that you would use the bisphosphonates first. So those are the older medications. But they do have more potential side effects. You take them for 5 years and then you stop them and allow your bones to kind of rebalance. And then after a few more years, if your bone density is dropping again, you can go back on them. But actually, those newer drugs, I'm always looking for, why has the person got osteoporosis? What can we do for the underlying causes? What is their nutrition like? What is their exercise like? All of those things. See if we can improve things that way. If somebody has a fracture, that's proven that they have got fragility as opposed to just what it looks like on the x-ray, that's also different, right? So if somebody's actually breaking their bones or their bones are breaking, it becomes more urgent than somebody where it just looks a little bit fragile on the x-ray.
Wow. Again, I'm very visual, so I'm picturing a lot of what you're discussing, and I'm thinking of a patient that I worked with in a hospital in New York, and he had fallen and broken his hip. And I worked with him over a summer, I believe. It wasn't too many months. I think it was 2 or 3 months. But he didn't end up living long. Is there any connection with what happens when someone does break, say, their hip bones or their pelvis?
Right. So this is kind of going into that, fragility. If your bones are fragile, that's one thing. If the rest of you is strong, right? If your balance is good, if your vision is good, you've been doing your exercises, so you're unlikely to fall. Fragile bones are not so worrying. But if you are frail and you fall, right, and you break something, really the fracture is a symptom of the frailty.
Can you expand on what frailty means?
Frailty means, definitions of frailty. Frailty can be physical, it can be emotional, it can be mental. It's resilience, right? It's lack of resilience. And so it's that bounce back, I guess. If you don't bounce anymore and you crack, that's frail. But if you're physically frail, you don't have strength, you're more likely to fall. Now, if somebody falls and they fracture their hip, if they're over 65, the chance of them dying within the next 2 years is 50%. So that's a really scary statistic. And that's why I always think, you really have to look at the whole person who has the osteoporosis. You have to look at the whole person who's falling. Why did they fall? Not just, they've fallen, they've broken their hip, oh, let me give them a new hip. The whole person is, why did they fall? So in the UK, before I left, in those last 5 years of my specialty training, every person over the age of 65 who fell over and broke their hip got seen by a medical doctor. So they weren't just under the orthopedic doctors, they were under the medical doctors as well, because we were looking at why did they fall, and seeing the whole person and giving interventions to support them through their healing and when they get discharged from the hospital, because we really wanted to prevent those deaths.
Wow. All I can say is wow, because I was so shocked and disappointed when my patient had passed away. And I knew parts of his history, but, I just still didn't quite understand why. And the hospital did attribute his death partially to the fall.
Yes,
So,
but why did he fall? That's the big question,
Yes.
Did he have a mini stroke? Did he have an irregularity in his heartbeat, so he passed out? All this stuff is really, really important. Wow. It's not, the fracture is just a symptom of the fall, and why did they fall? So that's a really big question when I see somebody with osteoporosis.
So important to delve into the whole patient's history, the issues around the incident, and as far as osteoporosis goes, knowing why it's developing, and then you get into the screening frequency and all of that. So having said that, can you sum up what our listeners need to know? You talked a lot, but just in a little nutshell, what can our listeners do to prevent osteoporosis?
Okay, so your nutrition starts in the womb when you're developing. So mums and future mums, your nutrition's really, really important for your babies. The bones start developing in utero, right? And then the nutrition of your children through their life is really, really important. Then, of course, being physically active and physically strong through your life, really, really important. As you're getting older, we lose muscle mass. Just as we're getting older, just aging, we lose muscle mass. So staying strong. So get strong and stay strong. So your weight-bearing exercises, you don't have to be pumping really heavy weights, but carrying a little bit of extra weight in your backpack, can help to build bone. And, when would you get checked? Talk to your doctor about your bones, get your vitamin D levels checked, make sure you have your annual health checks. Ask, if you're on steroids for anything, if you've been ill for a long time, as you're getting older, that's when we need to check and make sure that it gets checked again to see that things are stable.
Okay, I'd like to thank you, Dr. Annabel Fountain. I know that you're the endocrinologist from Fountain Health, and we want to thank her for taking time out today to talk to us about how we can prevent osteoporosis and enjoy a better quality of life. And audience, thanks too for joining us today. Please keep an eye on this spot for the next episode of Bermuda Health-Abets. Leave any feedback in the comments on Department of Health Bermuda YouTube page, and follow us on Facebook at Department of Health Bermuda. Stay healthy, Bermuda.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.